Melody Barr, and I am your mental health professional who specializes and assists veterans who have disabilities, and I work at the VA hospital. Just to kind of go over and briefly address the problem that I'm presenting to you today and how often it is occurring within my healthcare setting is PTSD, which is post-traumatic stress disorder, which is a psychiatric disorder that people may experience or witness traumatic events such as natural disasters or war and combative experiences or other various variables. Within the recent years that I like to bring to your attention is that the Veteran Affairs investigators have developed a better understanding of the symptoms of PTSD among veterans. It's been an ongoing issue among my healthcare setting and is growing to be, to back up my statement, in one major study of 60,000 Iraq and Afghanistan veterans, 13.5% of the deployed and non-deployed veterans screened positive for PTSD, while other studies shown the rate to be as high as 20 to 30%. As many as 5,000 U.S. troops who have served in these wars over the past 13 years have been diagnosed with PTSD. And this was pulled from an article written by Rizan Jam in 2016. Though, to summarize the main symptoms within the disease or the disorder of PTSD, it includes hyperarousal, which is feeling keyed up, as well as reliving the event or the experience over and over again, depending on the severity and how traumatically impacted the individual, as well as experiencing negative change in beliefs and feelings. The common prescribed treatment for this disorder is generally a trauma-focused psychotherapies, which usually last to 8 to 16 sessions. And on average, the severity of how one reacts to their PTSD is generally primarily the determining factor of the duration of the treatment. The recommended treatment is, as mentioned, could depend on how hard the cranium is injured, or if it is affected the cerebrum, or within the brain damage, the neurology surrounding internally the cranium. So it really has an array of dynamics to consider if and when one is experiencing PTSD, and it is a crucial issue and a very important dynamic to consider how the member had developed their PTSD. Though I'm going to provide essentially an anonymous individual and their basic health information with this particular disorder, PTSD. And as follow, a 32-year-old female, Caucasian, her socioeconomic status is within the middle class. Her previous medical issues consist of experiencing hallucinations, depression, and a concussion from an IED. And the member has been diagnosed with PTSD within the last year and is being prescribed trauma-focused psychotherapy and antidepressants that have been prescribed to her within the last 6 months. In conclusion, my recommendations for the health education related to this issue in general would be to ensure that you as a health professional need to keep record and track the progression of your patients and your clients in the increments of every month to see if the patient is making any progress instead of regressing. If not, if you're not reviewing the member's medical records again, you need to complete a holistic wellness checkup to see what further action needs to be done with the patient to see, basically take a step back and understand why is this patient not progressing And with the completion of the holistic wellness checkup, it could set back and set another tone of coming to the core issue or the root of the problem of why that member is not progressing with the traumatic psychotherapy. For further recommendations, you would have to conduct within time and reapproach differently to assess to ensure that the member is getting the appropriate medical attention. And what I would like to convey to you all, if and when you are treating patients with this issue, is it's essential that we health professionals are patient and have the patient's health at their best interest to progress instead of regressing and seeing them fall or deter from the program that they've been in for an X amount of time, whether it's one time or even to the 15th session within their therapy. So please ensure you have the patient's best interests at heart and you have the patience to assist that member to get on a better track. And some major problems that can still be solved, it depends on the depth level and the investigation further within the core issue that is causing the individual to understand their PTSD or get to the root of the problem and taking the time for that individual to heal mentally. That is where an array of major problems that still need to be solved today. And everyone is different, and every one of these members or veterans is already been scrutinized, and yes, they need plans tailored and dedicated to them. They need to be individualized. They need to be made special. So please ensure that you are investigating to your full extent and the depth of your capacities and capabilities to ensure that the member is getting the appropriate care. Thank you. Have a good day.